My name is Corey Smith. I'm a program manager in the Behavioral Health Division of the Indiana Criminal Justice Institute. Today, I'm going to provide you with a little bit of information, just some baseline information on how to fill out the newly formatted quarterly report. Before we jump into the substance of it all, I just wanted to go ahead and provide you with an overview of what the report looks like in its entirety before we start breaking it down section by section. As you'll see here, it identifies the county, identifies what quarter this is. You can do so by highlighting or however you want to do it, but just so that we know which quarter this is which quarter you're identifying this as. Just some information that you all can provide us with so we can help you. And then we get into more descriptive information on exactly what you all have accomplished in the past quarter. And then into the budget. Let me go ahead and move this down and we'll get right into it. So the first section is just providing the county name and the LCC coordinator information. This should just reflect who's working on the document. If a new coordinator is appointed, the change must reflect that in this form. You'd be surprised, 92 different counties, there is some turnover of coordinators out there. Now, in order for us to provide effective communication and effective assistance to you all, we need to know of these changes. One way of doing so is by listing it here. Another way of doing so, which I highly encourage, is if you anticipate a change in coordinator or a change has occurred, please don't wait months on end to tell us. Let us know immediately, because we do send out information to all coordinators in emails that we think is important for you all to know. If we are sending it out to the wrong email for a couple months, that's information that went unnoticed and potentially could have made an impact on your community. So let us know these things. All right, technical assistance requests. Really, this is just a simple way for you to provide detailed information on any assistance requests that you may need. One of our responsibilities at the Behavioral Health Division is to provide technical assistance to local coordinating councils, and that is actually written into statute. So we can't provide assistance if we do not know of assistance needs. So some of those assistance needs could have to do with statutory compliance. It could have to do with reliable data resources, assistance in the grant funding process, and so forth. Any barriers that you may have. Really, this kind of falls along with the technical assistance needs. But if you don't have any barriers or any struggles that you're having, you don't have to list anything. You can just write none, and that will acknowledge that nothing's going on. But really the point that I want to drive home is if you don't tell us about something, we can't help you. For us overseeing 92 different counties, there are similar barriers, issues, opportunities that we see across the state that are the same. Maybe it could be within a regional area. It could be one county in this southern Indiana is experiencing a problem that we just helped another county walk through in northern Indiana. So let us know so we can help you out. That is part of our role. Successes. One thing that we noted on all the previous documentation was that there was nowhere that you could celebrate what you're doing. Now, celebration is such a huge factor of a coalition's work, right? You are working to solve community problems that are difficult and are challenging, and you should be able to celebrate your successes when you accomplish them. So there should be some sort of success going on each quarter, and if there's not, then we need to have a further discussion. But let us know what's going on, because what you're doing and what you share, we are able to share this as well. With all of these categories, when we say provide detailed descriptions and whatnot, you don't have to get into like writing paragraph on paragraph. Make it just clear, make it concise. 2, 3, 4 sentences. If you can accomplish all that in that amount, great. That's all that you need to do. We're not asking to write chapters of a book. Just simple stuff to show us, hey, this is what our problems are, this is what we need help with, and this is what we're doing great. Okay, and then we're getting into the meetings that occurred during the quarter. Really, this is just simple information of where was the meeting, the date that it was on, the number of attendees, and that you took meeting minutes. Being honest with you, there should never be a no in the meeting minutes section, because you should always be taking meeting minutes, always. So in those meeting minutes, actually, you're going to be sending to the Behavioral Health Division at cji.in.gov. Now, the reason why this is an important section to us, we like to track the number of attendees that you're having, right? Because a coalition, it's important to have diverse membership, active membership. If we're seeing, say, one meeting you had 25 people, and then, for 5 meetings after that, you only had 5 people, that's going to make us ask a question: what's going on? Why is there such a decrease? Does this normally happen? And we can historically track this from quarter to quarter, from year to year. How is your attendance going? Do you need assistance with help on advertising and recruiting membership? And that's something that we can do. We can help you out with that and give you ideas. Okay, what you're looking at now is the programs and SMART goals section. This actually, if you're thinking to yourself, wow, this looks like the fun information document. Well, yes, you are correct. We actually absorbed some of that information into our quarter report. So here, what you'll see is the program name and description, the amount awarded, and the SMART goal that this program fits into. One thing that I will highlight again is that your CCP, the goals that you identify for your problem statements, you should be funding programs that are going to help you achieve that goal. Again, you should be funding programs that will help you achieve the SMART goals defined in the CCP. Therefore, you will see that in this area, the problem statement and the goal under that problem statement that this program goes to help achieve, you list that. Everything is tied together. Your CCP and your quarter reports, they are not independent. Even though they are 2 separate documents, they are not independent. They show us what are you doing to help achieve the goal. It's pretty simple information. If you have any questions about that, let us know. Again, program name and description should provide clear and concise information. There should be a nexus between the program and SMART goal identified in the CCP. And programs may apply to more than one SMART goal. That's actually something that, if you have questions with, you can, ask us. But say if your problem statement number 1 is adults in the county have alcohol, there's a high prevalence of alcohol abuse amongst adults in this county. And then the other one is there's a high prevalence use of prescription drug abuse in the county. Well, if there's a program that's funded under treatment intervention that goes to help out both adults with alcohol and or substance abuse or prescription drug abuse, you can have 2 different problem statements apply to one program. So it's just a way to tie the CCP, your plan, and your goals to the programs you're funding. And those programs should be helping you achieve those goals. All right, moving on to the budget. Right here, what you're seeing, this is just a quarterly, this is the first quarter budget based upon the programs that you saw in the previous slide, which I will go back to real quick. We have 1,000 in prevention, 2,500 in treatment intervention, and 3,000 in justice services. So we have went ahead and right here under this quarter expenditures, we've listed those numbers out. And for the first quarter, the expenditures for this quarter and the expenditures total for the year should be the same. You'll see here in a little bit that as you get into the second quarter, these change. Really, the approved CCP budget is the amount allotted per category approved by the LCC that was established in the quarterly, in the comprehensive community plan, which I will show you here. This is an example we had from the webinar, right? We had approved 3,000 in this category, 3,000 in this category, 3,000 in this category, and it was 3,000 total for the administrative. That way you're meeting the statutory requirement. And then, let's see here. So now let's move on to what it would look like, say, in the Q2 budget. Right here, you have where they say for Q2, they did a program, $1,000 prevention, 500 treatment intervention, but 0 in criminal justice service and activities. So therefore, what you do, you take the first quarter expenditures and the second quarter expenditures, they get added together to get your total expenditures for the year for that category, right? So in the first quarter under prevention education, you had $1,000. In the second quarter under prevention education, you had another $1,000. So total for the year, that's $2,000, remaining a balance of $1,000 for that category. And as you see, this is the progression from second quarter to the third quarter to the fourth quarter. Now, something that you'll notice here, which I'm highlighting with these yellow boxes, is that these two numbers should equal this number, because this is your total expenditures with your remaining balance, and that should be your total approved budget. So total expenditures plus balance equals your approved CCP budget total. If you have any questions about how to do this, please contact us early on in the quarter, because again, if you wait, we will not have as much time in order to assist you, because as you know, right before something is due, I mean, I'm a student, I know how it is. I tend to wait until the last second to turn a paper in. So if you guys have issues, let us know as soon as possible. Also, I just want to address this real quick. I know that, 92 different counties, every county is different. Some counties expend all their funds at the very beginning of their cycle. Some, they expend it in multiple different times of the year. Some have, mini grants, what have you. So if you do expend all your funds in the first quarter, that's great. That means that your second quarter, your third quarter, and your fourth quarter budget reports are going to be exactly the same. We want to design a document that could encompass every single county for how they approach their funding, and this is what this does. So if you have any questions about that, feel free to let us know. All right, and due dates. So our first quarter report, which is the quarters between April and June, because April 1st is when our submission calendar starts, our uniform submission calendar across the state for everybody. First quarter, April, June, it will be due on July 15th, and so on and so forth as you can read through this. If you have any questions about this, feel free to contact us as well. Questions and other info. If you have any questions, and you can reach out to your program manager, myself or Sadia. But if you have any questions and you don't want to reach out to us directly, you can always just send it to the Behavioral Health Division's email at bh@cji.in.gov, and you can title the subject as Quarterly Report Webinar. Other than that, that is all that I have for you. This information is meant to be just a baseline information. And if you have any questions, please feel free to reach out to us.